So a very good afternoon to all of you. I shall be speaking about the clinical presentation and visual outcomes in Stratismus syndrome. I have no financial disclosures to make. As we all know, Stratismus syndrome is a triad consisting of myopia, myelinated retinal nerve fibers, and anisometropic amblyopia. Stratisma et al. First reported 4 cases of Stratismus syndrome in 1967. So this is basically a large case series from a tertiary care center involving different age groups with different outcomes. So we did a retrospective analysis of the electronic medical records for a period of 7 years and included all the patients with typical Stratismus syndrome, visual acuity, investigations and treatment outcomes were recorded. In all, we have 14 patients and majority of them were males. The mean age of presentation was around 23 years and family history was positive in 14% patients. Majority of the patients had severe myopia, which was more than 12 diopter. At presentation, majority of the patient had uncorrected visual acuity less than 20 by 400, but after intervention, we had a couple of cases with visual acuity better than 20/100. The most common association with this syndrome was optic nerve hypoplasia in our study. Nystagmus and posterior staphylomas were also seen. So these are the patient charts. So these are the associations. The first picture is showing esotropia. The second picture showing developmental cataract. We can also see B scan demonstrating optic distrusions and posterior staphyloma in the fourth picture. So these were the records which we found. The extensive retinal myelinated nerve fibers can be seen in the first picture with hyperreflectivity on OCT due to the presence of these myelinated nerve fibers. And also on OCTA, we can see that there is hyperreflectivity corresponding to the presence of myelinated retinal nerve fibers. So majority of the patients in previous studies have been reported to have variable visual prognosis. But in our patient, we had 35% patients who had visual acuity 20/100 or better. So optic nerve hypoplasia, as reported earlier, was commonly seen in our study also. And patients with squint had poor prognosis in our study also, as reported earlier. But different in our study was that we found that we could have good visual outcomes if we intervene early and treat these patients properly. We had 2 patients in whom cataract surgery was done and proper patching was done. And we could attain 20/40 visual acuity in these 2 patients at the last follow-up. So associated anomalies like cataract need to be treated, extensive refractive error correction as with cycloplegic correction, and patching is to be done. So this is basically a large case series of Stratismus syndrome. And depending upon the age of intervention, type of myelinated nerve fiber, severity of refractive error, we can have variable outcomes. These are my references. Thank you.
Do you know any entity called
reverse? Yes, it is basically hypermetropia, and we did not include those patients. We found while we were reviewing the records, we found 2 patients with reverse Stratismus syndrome also, but we didn't include that. We concentrated on the Stratisma only in this study.
So in this study, which was the most commonest anomaly, number 1, number 2, which you
optic nerve hypoplasia was the most common association. In 9 patients, we reported that. Then we have posterior staphyloma, and we also had the presence of squint in 2 patients and also nystagmus in 2 patients.
How did you go about the management in these
Yes,
patients?
management. So basically 2 patients also had developmental cataract. So we underwent cataract surgery in these patients, followed by full cycloplegic refraction. And then we had to do patching also, 4 hours patching. At least for a period of 2 years we did, and we could attain 20/40 in these 2 patients. I've written it, mentioned in this. So just a second.
What about the squint in these cases? Do you address it?
Yeah. We could not perform squint surgeries in 2 patients we had. We didn't have the records of the squint surgery. We could not, maybe the patient, because this was a retrospective study, I think the parents were not motivated enough to undergo squint surgery at that point of time. So squint surgery was not done in these patients. It was not a prospective study. So we don't have records of that. Just it was like we did the cycloplegic correction in those patients.
All right. Thank you.
Thank you.
Thank you.